oftentimes when you're going through a trauma or you're going through rehab, it's you're going to one place and you're getting one or two types of treatments. So maybe you start out at your physical therapist, right? And most of us go to PT because we get a referral from our physical therapist, from our doctor,
primarily.
Right? And we see half of our patients who see us, they're getting physical therapy. We treat a lot of pain conditions. We do a lot of rehab. And so they say, I've been going to PT and I don't know how I feel about PT, and I feel like now I've hit a plateau. Or what more can I be doing?
Right.
To get better fast. Everyone wants to get better now and faster and without drugs because no one wants to take that long term. And what your physical therapist is doing is regaining range of motion, flexibility, and strength in your motor movements. That's what your physical therapist is doing to the most extent.
Yeah.
Now, what can be still causing pain and keeping you from getting better faster is tight muscles, trigger points, adhesions, poor circulation, the neurology, the nerves not firing into the area correctly.
Yeah.
Inflammation. Full of inflammation, and your physical therapist for the inflammation is using ice. They might be using some ultrasound, right? They're getting you to move to circulate the blood.
Yeah.
Oftentimes it's painful there.
Yeah.
You just had an operation, you just had a trauma or injury, you're in rehab, and they're saying, okay, now move this and lift that and stretch this, and you're like, this really hurts.
Right out of surgery.
Right, yeah, this really hurts.
Surgery, they want you moving.
I feel worse from doing all this movement. Is something sometimes I hear, right?
Oh yeah, often. It can be tough when you're recovering from a surgery. They want you moving right away. Hours after the surgery, they will send a PT in and get you moving. And it's important. It's necessary therapy, but it can be painful, and the recovery is tough. Takes a lot out of our patients when they're going to PT or just enduring those type of therapies, and it's great for them. But I feel like Acu is fantastic because we can help people recover from those that soreness, that weakness that you're feeling. Acupuncture in itself, we can modify treatments to help people with their endurance, to help people with their overall feeling of weakness, exhaustion. You can get a quick rest on the table, like you mentioned, and feel better after, feel even ready to go back to physical therapy, So I think that's important that Acu and PT are combined.
Yeah,
PT is fantastic.
We should talk more about this PT, right, and how specifically acupuncture is going to help them.
Yeah.
And we tell patients time and time again, yes, go to your physical therapy, but the way acupuncture is going to speed this up is I wish everyone looked up. I wish they Googled trigger points, adhesions, restrictions, myofascial restrictions in the tissue. And I think we can zoom in here on this muscle man right here.
Yeah.
And so all this red here, this is all muscles. These are all muscle fibers right here. So why don't we take right here, we'll use something very common, which is the knee.
Yeah.
So this is the person's knee right here. And all this white stuff, these are all tendons, and tendons turn into muscles. And so what happens here is these trigger points and adhesions, they're like little rocks of tissue that form stuck right in there. And now here is supposed to flex and contract. You know how you flex your bicep and it gets big?
Yeah.
It's because it contracts into each other. And if there's a rock of muscle tissue stuck in the way, when you go to do that movement,
that we're looking for,
it
and
hurts.
Pain.
It hurts when you go to do it. So acupuncture is perfect to speed up physical therapy. Is we go in there and we break it up. We just do this and we break it up.
Yeah.
And now the blood goes in there and it brings circulation. And now all of a sudden your knee feels better because the circulation is now able to get past that rock of tissue that's now softened up, and now it's come down into the knee.
Carrying that fresh nutrients that's needed to help with the repair.
How often do your patients tell you that when you put a point in around an area that all of a sudden it feels warm?
Yeah, often.
Or they feel tingly, like a warm tingly, not like a bad tingly.
Yeah.
Or something, or movement, or like there's a shift almost.
Movement,
after we put in a needle, and these needles are not painful. They're very thin. So we found a rock of tissue right up here, and we loosened it up real gentle. And now the blood starts coming through, and within a few minutes, all of a sudden you feel warmth happen to your knee, and your knee's been killing you.
It's the blood rushing.
And now it feels somewhat better.
Yeah.
And then now kind of comes down here. Now you kind of feel it into your foot, and some people have that sciatica, or sometimes they have cold feet. or sometimes they get spasms in their legs, right, in their calves. And I know we hear that sometimes that's a potassium deficiency and magnesium. That's also true, but sometimes you just need more blood in the area.
Yeah.
And the more things you can get to loosen up the circulation, like if you have a bunch of rocks of tissue stopping up circulation, the more blood flow that comes down. Now that helps your muscle spasm somewhat. And now that your foot doesn't feel as cold as it did, and then you were coming in for knee pain here, and now that knee it doesn't hurt that much when you go up and down stairs. And you did a couple treatments of that, and you combined that with your physical therapy.
Physical therapy, yeah.
And now all of a sudden, instead of taking months, it took a couple of visits.
Yeah.
And that's the kind of progress we see when you combine PT and acupuncture.
Yeah, all the time. It's a beautiful process, and I love that we're able to offer that therapy. I mean, it's symbiotic.